Donald Trump waved the white flag, surrendered to the virus. But the American people don't give up. We don't give in. Unlike Donald Trump, we're not going to surrender to this virus. We're simply not going to surrender.
This virus is going to be with us forever.
One of the things we've spent a lot of time thinking about in the last many months, and we're going to continue this work, and you'll hear more from the administration on this, is getting us out of that acute emergency phase where the US government is buying the vaccines, buying the treatments, buying the diagnostic tests. We need to get out of that business over the long run. And so my hope is that in 2023, you're going to see the commercialization of almost all of these products. Some of it is actually going to begin this fall. In the days and weeks ahead, you're going to see commercialization of some of these things. So we just move them into the regular healthcare system.
But the pandemic is over. If you notice, no one's wearing masks. Everybody seems to be in pretty good shape. And so I think it's changing, and I think this is a perfect example of it.
Well, I think the best way to consider if we're going to have the pandemic pronounced as over, it would mean that we've contained the virus, and they wouldn't have 400 to 500 Americans dying every day for the last 6 months, and you wouldn't have millions of new infections each month. And we have absolutely no way to counter long COVID.
Long COVID conditions include a range of health problems.
It can affect the brain, the heart, the kidneys, the pancreas, like literally every organ system. So it's not a small problem. It's not a trivial problem. It affects anywhere between 5 to 30% of the people who got COVID-19 in the first place. And if you go with single digit 5% of people with COVID-19 will get long COVID or have gotten long COVID, that translates to millions of people in the US and many, many, many more around the world.
16.3 million people, around 8% of working age Americans, currently have long COVID. To put that number into perspective, nearly 1 million people are living with multiple sclerosis in the United States, 1.2 million have HIV, and 1.7 million are diagnosed with cancer each year. Beyond the physical and emotional burden, the bills just keep piling up.
Now more than 2 years out with working with this condition, and we have seen individuals who have had symptoms for a year and a half or 2 years out after their infection. So it does really seem appropriate, this name, long haul, unfortunately. 75% of the patients we have seen here at Mayo, they only had a mild illness. They didn't have to go to the hospital, the ER, or even their primary care provider.
Long COVID conditions can develop up to a year after a COVID-19 infection, even after a mild or asymptomatic infection. The researchers examined data of more than 113,000 unvaccinated COVID-19 patients and nearly 34,000 vaccinated patients who had experienced COVID-19 breakthrough infections.
So vaccines reduce the risk of long COVID, but do not eliminate the risk of long COVID.
The researchers discovered that even vaccinated people with breakthrough COVID-19 infections, including mild and asymptomatic infections, can experience debilitating long COVID.
Long COVID can manifest in multiple different ways, including brain fog, fatigue, neurologic dysfunction. Some people have strokes, some people have heart problems, arrhythmias, their blood pressure drops, or they have really very fast heart rate.
A national study from Cedars-Sinai Hospital shows that deaths related to heart attacks increased across every age group since the spring of 2020. But the group that saw the biggest increase isn't who you might think.
Young people are obviously not really supposed to die of heart attack.
But the relative increase in heart attack-associated deaths among 25 to 44-year-olds was a staggering 30%, more than the increase in middle and older age groups, which ranged between 15 and 20%.
It's not like you have COVID, you recover, and the next day these heart events happen. There can be the passage of time.
There can be the passage of time, and with long COVID being a bigger and bigger issue, we don't know. And the more you have COVID, it seems it puts you at a higher risk, especially in those young adult ages, at getting something like this. And so you want to make sure, even if you're vaccinated, you still protect yourself from getting COVID.
It appears to be a cumulative risk. It isn't that the second infection or third is worse than the first, but that there's this if you will, a dose response. That is, the more infections, the more chances that there could be this chronic condition. So this is all the more reason that we pull out the stops to prevent COVID. We know vaccines can help to some degree, vaccination, but it isn't at all foolproof. And so we have to keep preventing the spread as much as possible to avoid this phenomenon. There's only one good way we know to prevent long COVID is never to get COVID.
As the potent Omicron BA.5 variant pushes through the community, even the vaccinated, people who got COVID early on are getting sick again, some for a third and even fourth time.
It's not something, to fool around with.
Doctors at Washington University in St. Louis looked at medical records of more than 5.6 million people treated in the VA health system. They found those with 2 or more infections had more than twice the risk of dying and 3 times the risk of being hospitalized within 6 months. They also had higher risks for lung and heart problems, fatigue, digestive and kidney disorders, diabetes, and neurologic problems.
Some serious severity issues. We already know that everyone is at risk for long COVID, even if you have a very mild course of COVID.
Researchers also found the risk gets higher with each new COVID reinfection. ABC 15 Health Insider Dr. Shadmar Vasti says that's a major shift in typical virus behavior, where we often build up an immunity each time we get sick.
Even if the case ends up being just mild, you could have risk factors down the line that you normally wouldn't have for something like the cold or flu.
That's right, Akiko. A new report citing the Census Bureau's household pulse survey shows that up to 4 million, between 2 and 4 million individuals are now out of the labor market due to suffering from long COVID. That has an impact of potentially a cost of lost wages that could range from $170 to $230 billion in a year. And that encompasses 16 million Americans that have said that they have experienced long COVID today. And that's of the working age group, so 18 to 65. So significant numbers there.
I want to be a nurse. I don't have that quick thinking. I can barely remember what I did with paperwork from yesterday.
Americans suffering from long COVID have cut back work hours, switched roles and industries to accommodate remote work, sometimes reducing their salaries or retiring earlier than planned. As many as 4 million people are likely out of work due to long COVID. According to one study, long COVID could cost the U.S. $3.7 trillion, more than $2 trillion for the cost of reduced quality of life, nearly $1 trillion for reduced earnings, and roughly $500 billion for increased medical spending.
Do we know enough now to believe that long COVID is a serious problem? That is an unequivocal yes.
The Biden administration is planning to end the COVID public health emergency on May 11th. That marks a shift away from responding to the pandemic as a national crisis and instead managing the virus more like a seasonal respiratory disease. The public health and national emergencies have enabled hospitals to respond more flexibly when faced with spikes in patient volume. It has also effectively barred states from withdrawing people from Medicaid. And that is just the beginning of it, Andrew. You think about all of the things that will come from this. This has been a huge issue when it comes to not being able to kick people out of their homes or their apartments if they haven't paid the rent or the mortgage. It comes to student loans that have been extended time and time again, based on the idea that we are still in a national emergency. And it's counter to what Biden himself has said, that the pandemic's over.